And right now we're talking about 4 things to know before you enroll in Medicare with Kevin Dorr of Mapping Medicare. So right before the commercial break, you saw those 4 questions on the screen. This is what we're covering. When do I enroll in Medicare? I'm turning 65, still working, and I have employee insurance. What do I do? I'm turning 65. I have retiree insurance.
Yep.
What do I do? I have health issues. Will I need to pass medical underwriting? Now, Kevin, there are multiple forms of Medicare. When we're talking about this, are we talking about Medicare Advantage, the Medicare Gap plan?
Yeah, good question. Actually, for what we're talking about here, it can be all of those.
Okay.
Pretty much. And I've added a couple extras as well. I mean, we'll start off with the easy one. I'm turning 65. What do I do? And we've talked about it before. You have your birth month that you turn 65, 3 months before that, and 3 months after. So you have that 7-month window. We've talked about that. But what if you're retired and you retired at 63 and you've got Marketplace? What do you do then? Marketplace is not considered. Marketplace insurance is not considered creditable coverage. So you will get bounced off Marketplace at the end of the month before you turn 65. And the issue there is you may or may not know that. If you don't know that and then you start to apply for your Medicare card on your birth month, you're going to have at least a 1-month gap of health care coverage.
Okay, so it's really important to kind of do that as soon as your window opens up.
Yep. When you 3 months prior, so you can get ready for that. It's the same thing if you've got COBRA. If you've lost your job, then you're turning 65. COBRA, it's a great safety net because you don't have coverage, but it's not considered creditable coverage. You can't have both at the same time. So again, you want to be ahead of that before you turn 65.
What if I'm employed, turning 65, and I have insurance through my employer? Should I still apply for Medicare?
That's a good question. It depends. The answer is always it depends. If you continue to work after the age of 65, if the company you work for currently has creditable coverage and has at least 20 employees, then you can delay enrolling in Part A and B. You don't have to, but you can. But the good question to ask your human resource benefits administrator is to have them walk you through what might be available if you get a health care package once you retire. Okay,
and then it sounds like kind of a similar situation if you have retiree insurance. You might be saving some money if you go for Medicare, you might not be.
See, that's a real good question because employer benefit coverage is typically different than if you're an employee. Employer benefit coverage is also not considered creditable coverage. So again, you need to talk to your HR department, the benefits administrator, to find out what you're obligated to do. If you do enroll in Part A and B, you just need to know what you're getting into.
And really quickly, because we're running out of time in this chat this morning, what if I have health issues? Will I need to pass medical underwriting?
Yeah, that comes up a lot with Medicare Advantage plans. Any Medicare Advantage plan by any carrier, there is no medical underwriting. When you're initially eligible for Medicare, you've got a window that where there is no underwriting for a Medigap plan. Once you're outside that window, you will go through medical underwriting.
All righty, Kevin, we have some information up on our screen. You will be at Dead River Coffee in Marquette tomorrow at 9 a.m. to answer Medicare questions. Any other key takeaways or any information you'd like to share real quick?
I think we're good. The main thing is, we've talked about it before, you have to take control of your own health care. And doing that is, when you turn 65, start looking at all this.
Look at all your options, lay out all your bases. I wanted to thank you for keeping us updated, Kevin.
Thanks, Tia.